I'm Shivs.
And I'm Nats, and together we are the Sisterhood Circle podcast.
Our vision is to create connections with our community and inspire change in the world.
So be sure to subscribe on whatever platform you're listening to find out more.
So let's dive into today's episode. Hello everybody and welcome to this special episode of the Sisterhood Circle podcast. We have a beautiful, amazing industry specialist here with Nurse Debbie, who is our fertility, infertility expert for the podcast that we have got today. So the reason that we wanted to bring Debbie on today was to talk about a growing challenge that we have, not just in the UK but worldwide. Yeah, with 1 in 7 in the UK struggling to conceive, and male infertility on the rise just now, and us working within Curves, we see a lot of women really struggling with this day in and day out, and we wanted to bring Debbie's expertise, our stories onto the podcast.
Plenty of them.
So we just firstly want to say a massive thank you for you taking the time out today to come in and have a wee chat with us.
Thank you for having me, ladies.
Yes, so we're really excited about it. So I first met Debbie when I went along for a treatment. I put 2 hours in my parking and made it back with about 3 seconds to spare, and I came in for some acupuncture, because I have had my, as you all know from listening to the podcast, I'm actually sick of talking about my injury from... No, it's not an injury. Well, it was an injury. Anyway, so we came in and we ended up talking for about 45 minutes, and you know that way when you just click with somebody, and we just talked about energy.
I know, about everything really, didn't we?
It was a beautiful chat, and straight away in my head when you were doing all of the treatments, I was like, I'm going to ask her to be in the podcast. But see, to be fair, before I even came on that...
Yeah, so my first experience was your social media.
Right.
I always had you in social media. I think off the back of like Clinic 22 and stuff, and I was like, every time I would stop and I'd be like, oh, what's she got to say today? What's the crack? And I was like, oh, she's a pure vibe. And that's when you were saying about obviously your injury and struggling, the dry needling. And I was like, why don't you check out Nurse Debbie's page? So if you were my pure best pal, go check Nurse Debbie, by the way. And I was like, honestly, you'll pure love her. And I was like, I think she's something that, like, for the podcast, like, that's such a big topic. But I was like, go see what your thoughts are. When you come out and you messaged, I was like, this is going to be great.
I was like, she's the one. She's the one.
It just makes such a sensitive topic so just understandable and normal.
We should be talking about it.
Because the secrecy is a big thing.
Definitely.
It's the hardest thing for people, and it's so...
And probably I didn't start in the fertility, like you realise, and the things you should and shouldn't say to folk. It's mind-blowing, but it is a journey, and folk go down the rabbit hole and you spend half the time trying to pull them out the rabbit hole and tell them it's going to be all right, and then you've got, accessing services.
So listen, we're going to dive right in, and the reason that we're going to do that is this topic could go wild. It is going to go in lots of different directions. So the first thing that I just wanted to chat about is your background. You were a nurse.
Yep.
I would just love for you to tell me like how it started, how you got into the
nursing.
NHS and nursing, and how you kind of got to where you're at just now.
So as you all know, I'm a big believer in the universe, and your path's made out for you. So anyway, I started in the hospital as a domestic, and then built up for the domestic, went back to college, done stuff, then worked in the kitchens as well. And then for the kitchens, my mum worked in Jaeger, she get paid off, so she said, Debbie, go and get a job, I'll watch the rains, just go and do it for the day. So, and a job came up as an auxiliary. So I worked in a surgical ward as an auxiliary, and it was a sister in there that said, go and do your nurse training, we'll support you. It was through the government at the time. I don't even know if they still do that.
I don't know if they do still do.
So, I mean, it was years ago. So they would pay the ward. It was when they thought they were going to run out of nurses.
Right, okay.
And they thought, right, what's the next best thing? The auxiliaries. So they paid the ward 10 grand or something, like, to cover my shifts while I was out training. Wow. But it was different training for, like, going to uni kind of thing. It was in-house training. So you were sent like to A&E and no different, like 4 months. It wasn't like a 6-week placement, so you get great training. Because what they thought was, you've already done it for years, so you can up a next step. It was 4 years training anyway, and then at the end of that you get a job. You could go back to where you worked or whatever. So anyway, I went back to where I worked because I loved the lassies and I loved the place. And then probably worked there for about 3, 4, maybe even 5 years, can't remember.
Whereabouts was that?
In surgical and
right,
Cross
surgical,
House.
right,
aye.
okay. Right.
And then management changed and they brought in folk that didn't know what they were doing. So anyway, there was, I think, in total, there was probably about 20 people left just through bad
poor
management.
Oh, wow, right, okay.
I think even HR get involved at that point because it flagged up.
What the hell? Why is there so many people leaving?
What is going on here? We were told, it's just, the natural, like, people leave and they're, retiring and that. And
how many's normally in a staff base?
30.
So 10 people.
Aye. So I was like, no, I don't think so. Anyway, I always thought I would have left, like, surgical ward working and that, I'd have retired from that.
Right, okay.
But I was actually fed up getting him and moaning to James, and he was fed up listening. And he said, just leave, find something and go. Yeah. So I went up and I spoke to a woman who worked in research and development because I thought I'm quite drawn to that. Anyway, there was a couple of jobs come up and I went up. I wasn't successful. You've got to really apply for the jobs like 2 or 3 times before you get in.
Yeah.
So you've got to do like special training. So I thought, right, I'll do the training and we'll just see. And she'd said, if bank work comes up, you can come up and get your teeth into it. I said, aye, that's fine. And then there was one night I was working at the hospital and the lasses were like, why do you not join the union? Go to the union if you're looking for something different and then you can basically change everything that's happening here. So I said, right, let's do that. So I met up with the woman from the union at Costa, as you do, found out all about it, but so did management. So literally about maybe 10 days after that first meeting, I got a phone call through the back office. And when you're shouted through the back office,
you're in for something.
And they would never have phoned me. Do you know, I wasn't like a senior or anything. So they're like, she's through the back and phoned you. So I was like, what is it? And she was like, I just want to know if everything's all right. I said, everything's fine. She said, basically it's been brought to my attention that you're wanting to go into the union, be a representative. And I said, aye, I do quite fancy that. I fancy a challenge. So anyway, long story short, she was like, but what is it you really want to do? Like, 'cause, you could do that. We'll support you because I've got to say that. But what is it you really want to do? And then through that moment, you've got to make that decision.
Yes. The scales are tipping.
So I'm a Libra, so... weighing it all up. And I thought, right, the folk in here do but when it comes to it, who are you going to look after? You're going to look after yourself.
Yeah.
Because people will tell you and they'll stick by you, and then when it comes to it, they want an easy life. And I get that as well. They're like, no, whatever. Don't want to, cause any trouble. Whereas I'm the troublemaker. So basically she said, I was talking about R&D and they were promoting that, they were pushing that for me. They were like, I think that's the best decision for you. I think you should do that. So basically the end of that conversation was, I'll no do the union, but you'll give me a secondment in R&D.
Do you feel like they pushed you to that because they knew that you might have been trouble?
Aye, 100%.
That's like
100%.
Yeah.
So I was actually kind of like, well, they think I'm going to, I could do that. Do you know what I mean?
So in your head, you're like, actually, should I be doing this? Are they trying to block me here?
I'm thinking, I'm actually flattered. They think that I could actually
It's putting a wee bit of power in your hands of like, what did I actually want? And for something that you tried for but had been unsuccessful for initially, you then go, that's the universe going, right, that's where you're
that's where you should be.
You're meant to be there.
And then I followed it up by an email because every day when I come off the phone, every day was like, that'll never happen. And I said, well, because I'm going home right now to write an email. Paper trail. And I was like, I spoke to it on the phone and done everything basically. I had to push for it, but it did happen. And it got me a job in R&D.
Wow.
And then,
which then led me to, well, first of all, I done the colorectal cancers.
Yes.
It was great, I loved that. Then I worked in haematology, the clinical trials nurse for that. And then there was a girl who'd actually left. She'd had her kids and just wanted to go back to the wards. And it came up like a kind of women's health one more that she covered. And my boss at the time, who's lovely, had said, I never even thought about you, Debbie. I thought you were quite happy in haematology. I said, but I fancy something different. And it came up, so I took over her trials, and then the fertility trial came in. It's called the Loki trial. It was working with women with polycystic ovaries.
Okay, tell us about that.
So it was called the Loki trial. So they were given Clomid with or without metformin. Just to see if we could stimulate ovulation, get their endometrium lining, regulate their cycle. So it was my job basically to recruit women and support them through their full journey.
Okay.
And it was a fantastic trial. We actually changed the policy at the end of it. So you have to have your BMI. Everybody needs to know this.
Okay.
If you've got polycystic ovaries, this is so the flow chart is your BMI has to be 30. You'll hear this all the time about BMIs. Yeah. It's going to be 30 and below to get any treatment.
Yeah.
If you've got polycystic ovaries and your partner's semen analysis is hits the criteria, you can get Clomid. Your BMI can be 35.
Ah, right, okay. Because I think, I've spoken to a few people, is it IUI?
Yes, IUI needs to be 30.
Oh, is that 30 as well?
Yes, that
right,
needs to be 30.
Regardless of if you've got PCOS.
Regardless, so I used to say to the lasses that run the trial, use this time wisely. My job is to try and get you pregnant before you even need that, right? Let's do this. Let's work together. But ultimately, go to do strength training, do all these things, eat sensibly, because it was good because they felt as if they were doing something. Yeah. You weren't guaranteeing them a pregnancy at the end. You can't guarantee that. But getting
them in the best physical shape, emotional.
I'm like, use this year wisely. Yeah. We'll get your cycling track. We'll try your Clomid, your letrozole, whatever you've been randomised to. And then if they lost the weight, then they went for their you go and get your tube tests and things like that, and then they go in the IUI. But it was great. But what I noticed was some of the girls were getting a follicle, but the lining wasn't great. Okay. And you need a lining, a 7 or 8 to basically support pregnancy. Yeah. So, of course, my wee brain's ticking. Yeah. And I'm thinking, acupuncture would help them. Because I'd done acupuncture, just for aches and pains at that point. Yeah. And I thought, I think acupuncture would help them. How
would it help?
The blood flow to the uterus.
Right, so what would happen
cortisol
there?
switching down.
Right, okay.
So, basically, it's not just about blood to the uterus. It's about cortisol going in, turning it down, somebody speaking to you for longer than 10 minutes.
Yes.
Being less clinical.
Yeah. In a nice environment with somebody they already know. Yeah. You're not lying there legs a kindle and, you know what I mean, scanning. So it was like just taking that time to talk, how's your relationship? You know, who knows about your fertility journey? You spoke to your pal, blah, blah, blah. Or just even to offload, like my pal's pregnant and I feel like shit. I feel happy for her, but I feel like shit. To somebody to say, that's normal. Yeah. You're allowed to feel like shit. So then I had kind of said to a few of them, just want to come and try acupuncture. Like, just let's scan you, try acupuncture and see where we're at. Yeah. And the lining was going up.
Wow.
That's mad. Now, see, in the medical field at that point, trying something like acupuncture, would that have been deemed like airy-fairy? Or like,
I was very lucky that one of the doctors I worked with was right into it.
Okay.
Aye, so he was literally like, yep, absolutely. Even if it's a placebo effect, you know, like, it doesn't matter. Yeah. Because it's...
If you believe it works, it works.
It's very different probably to what the norms would have been in terms of any kind of medical help, like there being like a prescription for it or something that was like drug based.
It's so hard to do because I've got a clinical nurse background now. With the trials, you can't do a clinical trial in acupuncture because you can't do sham acupuncture, which would be the placebo basically. You probably knows you put a needle in. Do you know what I mean? They're going to know, was that acupuncture, was it no? Well,
they touched me with it.
I felt, because you can feel the wee needle going in.
Of course.
So it would be so hard to basically say it was 100% the acupuncture that helped. But he was really good, and he would say, like if he was speaking to somebody and they said, I'm getting acupuncture, he would say, continue that. Yeah. I've also had IVF doctors that'll say to folk, don't waste your money. But give me 15 grand and I'll no guarantee you.
Exactly. And I think as well, see like what you had spoken about before when it comes to like the fertility journey, it's so clinical, and we know that you've got to be in a relaxed state, you've got to be in the right mindset, your cortisol levels have got to be low. So you go into like these appointments and you're up to high dough and you're speaking to somebody that isn't like you. What happens? It's like it's a stressful.
Even I get people that even say, even driving in, IVF's dead stressful to go through that, but like if they've not had a good experience, this lassie said the minute I park my car, that's me, I'm away.
Yeah. It's probably very
you become like 7 years old. I had a girl the other week there, and your BMI's got to be 30, and they're really strict about that. And I say to them, it's no, they're strict because they're spending public money. Yeah. And they have to, it has to be. Yeah. But she went in, and in fact, 2 girls, her BMI was like 30.2. And the lassie said, well, that's you can't get it. There you go.
Oh, God. And, and what's that, half a pun? No, £2.
£2.
Yeah. £2.
That's... See, that takes away... valid. It takes away every bit of, like, hope for that person.
She became 7 and getting into trouble for her mum.
Yeah.
Like she said, I felt as if I'd let myself down. I'd let my husband down. The lassie was saying to her, get your BMI between 28 and 29.
And we think,
and she said, I couldn't even speak.
What that does for somebody's like physical energy, where their stress is at. Like, you can imagine you go from this like being excited about something to everything just going, oh my God, closing up.
And it's on me.
Yeah.
And she's telling me it's on me.
So
I ended up having to print nice guidelines for her, because I said, see, to be fair, it's 13, by the way, I don't know where she's getting the 27, 28.
Yeah.
So I said, see, the next month when you phone in, like, you're going to have to get to 30. We can't change that. But take all the nice guidelines and just say, when did it lower?
Yeah.
There it's there.
I
think actually,
though.
and another thing as well, top tip here, ask them to redo your height.
If you've got your height wrong.
Because see your height, your GP probably, I mean, see, to be fair, as a nurse I've done it as well, GP sends somebody up, you're like, you lost any weight? No, that'll be the same then. What height are you? I mean, I couldn't say the last time actually.
Everyone's, I think I'm about 5'4", maybe 5'3", and that makes a difference.
Top tip, add on 2 inches. Don't check your height.
I'm 6'2". And literally she was like, there was one girl and but it was her husband said, what height have you got for a, he was on it, and it was 2 centimetres, and he said that made all the difference. That made a difference to the BMI.
I think some people as well though, like with BMI that we come into contact with quite a lot, don't really understand either what it maybe takes. They're told that like your BMI's got to be under 30, crack on, we'll see you and we'll deal with it then. And they're maybe sitting at a BMI of like 36, 37. They have got no idea what is actually required. It's just your BMI under that, rather than right, this is where you're at, this is how many pounds we're talking, this is what I would recommend. If people were just given that little bit of this, or is even what I can do.
Right, that's fine. But what we'll do is refer you to a dietitian, and they'll maybe
or even create a frigging plan.
Yeah, because you
like
can
this
see why people go into those appointments, and we see it all the time. Like we talk about that hope and that whole like just this is going to happen. Going at that appointment, they're like, right, I'm 37, I need to get a 30, with no idea how to get it. What's involved to do it? They come out, they press the big effort button and go, well, this is just never going to be able to happen, is it?
And
also, I had a girl, and we didn't know this at the time, and she came to me for acupuncture, and that's where it came out. She'd had an eating disorder when she was younger, and I thought, God, that's just going to totally change practice, because we'd been saying to her, you need to lose weight, you need to lose weight. And then when she came for a wee session, she was like, can I tell you something? And I said, what is it? And she said, I had anorexia when I was younger.
So to hear that,
she says, so see if they tell me that, I can go back to a Kit Kat a day. But I don't want it, because I know that's not going to be the healthy thing for my body. So I had to go back and say to them, look, we're telling this lassie to lose weight, but she actually needs support.
And like, how to do it. Like,
I think they're away from like actually treating like the person as who they are and what they've got on, and it's just, it's another person that wants this and I don't fit the criteria, move on, rather than actual care and support for that person.
Definitely.
And I think that probably circles back quite nicely to one of the kind of final straws for you within the NHS. I would love if you could tell everybody that's listening, see the experience that you had with the clinical trial with the periods. Could you you talk about this? Because see, when you spoke to me about this, it literally made my blood turn cold. It's horrific to think that these things go on.
When I done the local trial, you would normally run 2 or 3 trials at the same time. So there was another trial, I can't remember what it was called now, but basically it was a depot injection. They were trying to, instead of giving you every 3 months, you were to get it 6 monthly. Well, that didn't sit with me anyway, because I'm no into contraceptive.
And we'll talk about that later, definitely.
But it's not a great thing. Anyway, the school, they tell you how not to get pregnant, but nobody tells you how to get pregnant. There's only 2 days a month. Anyhow, so it was but it was an American trial. So the Americans come out, and we went to see Mill Hydro, and we're all sitting eating lunch, and they're saying, right, this is how it's going to work, because they've got to do, if they're doing a clinical trial, it's got to be all over the world. You've got to do a pocket for everybody. So there was like Mexico, Africa, all over, and then the sexual clinic in Irvine.
Where else would you go? Do you know what I mean?
And I'm like, that's funny. But it was already up and running in these other countries. But in a clinical trial, you can only, so see if they had any more than 3 or 4 pregnancies, they would shut it down, because they would say it's not working. Anyhow, they were like, right, so we need to work out a plan that we know that somebody's A, not pregnant, like when they're on the trial, and B, they have to be on they have to be menstruating, they have to be on their period when they get this injection. So that was fine. But they had found in Mexico or Rio or something like that women were taking buses for 3 days.
Because they're paying them for the trials as well. So just
because it was an American trial.
Yeah.
You get up to like £500, right? And obviously the age group as well was like
impressionable.
Yes, So you maybe know of a lot of money, and you maybe at college or uni or something like that. So that's
good old pharmaceutical industry.
That's who the poster. That's where it was to go.
Quick £500 for a lot of people.
Oh, it's a wee holiday at Ibiza. Do you know what I mean? But
it's as long as you're not pregnant.
That's true.
But they're not thinking about the long term. The long term health thing.
They've just
thinking about the money
dangled to them, and it's like, morning.
So they were saying everything had went wrong in other places, and how could we correct that here? And one of them obviously was to make sure when we gave them injection they were menstruating. So they were like, we've had problems with that other places because they were just saying, I'm on my period, but they weren't. And they were taking it just for the money, and you get that. So they wanted us to check the pads to make sure they were menstruating. And honestly, see, to be fair, we just well absolutely no way. Even the gynaecologists, they're like, that is not happening. But that's what the trial companies wanted us to do. Was to check people's pads to make sure that they were on their period before we gave them injection.
Can you imagine, right, this is where my head goes, right? You're willing, because you don't have enough money, willing to give your body to science, right? And then what happens is you go in and they say, prove to me that you're on your period. As a woman, that's a time you don't feel great anyway, and you're having to show that. And you're so young. I just feel like it's just such an abuse of power.
You probably do that because you were young. You would just go, well, listen,
whatever I need to do.
Well, if you think about these girls that are going through the trial that have maybe went to it because it's a quick £500.
And some of them were young mums.
They do, I imagine. They probably wouldn't feel confident or assured of themselves enough to be like, no, I'm not comfortable with that actually. And it just goes to show you, like, it's that whole pharmaceutical thing where it's not about the person, it's not about helping.
It's about collecting the data.
It's I want the data
and the money.
I'll use your body and I'll do anything that is required to do it. If it's going to cost us a few £1,000, then it is what it is, rather than it actually being about that person and the help.
I know, and there was only ever one patient on that trial that said, what happens if I get pregnant? Because that was one of the things. How will I be supported? And I thought, God, nobody's actually thought about that. You know, how
also trialling these young girls at the risk that there could be unwanted pregnancies and the implications that then has. One,
well,
if they
they
go on
terminate in later life, it feeds back.
Or if they then go on to have the child and they're not in a stable enough relationship, or they've not got the funds to be able to do that, like the risk attached.
The only good thing about Trump coming into power was he pulled it.
Yes,
he pulled it. He says not because he's pro-life, so he was like, he pulled the funding, so it basically shut down overnight.
Wow. Was that for you like a bit of a final straw?
I had left
in you.
Okay.
Because I had said, I can't do that.
No.
Because I'm literally telling folk in my clinic at night, watch what you're putting in your body, blah, blah, blah. And then these young lasses were coming in and you were like, oh my God,
and you refused to inject them, didn't you? Because
I'm like, I can't do that.
Yeah.
You can do them.
But you were saying as well, like having like them coming in, being injected, and then you taking them down to collect their cash. And that's like, see the thing from, I imagine, right, being a nurse, you get into nursing to look after people. And it becomes so transactional. And this is like, for me, when I look at the NHS now, and don't get me wrong, I know there's a lot of people doing a lot of good jobs, maybe not even so much the NHS, maybe more the pharmaceutical side of it. It's so much about money and corruption, and I just think it's so the opposite of what it should be. Healthcare is no longer healthcare. No. And I can see why you made this the business. And do you know what? Sick people make money. Desperate people make money. When you're well, like what we were talking about earlier, see if you were to tell somebody that's coming along, like see what you do in your practice, right? You teach them how to look after themselves hormonally, cortisol, keep the levels low, what to eat, what to drink, how to stay calm, how to treat themselves. You do all of those things. Can you imagine doing that with everybody to start with? Honestly, so just the other week, this is funny actually, because there was 5 girls that were coming to me. The kind of 2 of them kind of knew. And anyway, they were sitting around a table. It ended up, they were like, "Do you go to Nurse Debbie?" I go here, I know. What do you go for? And so they were kind of chatting, and there was one girl sitting in the group, and
anyway, long story short, she was coming, but for different reasons. It was IVF and things. And she was just listening to them and doing what I was telling them, right? Like, keep your feet warm, you know, do this, take that. And she got pregnant.
Wow.
Just by listening to them and kind of saying, oh, I'm going to try that, I'm going to do that. Small changes, just very, very small changes.
So what's the feet warm thing about?
Oh, it keeps your uterus, it keeps the flow of blood to your uterus warm.
Really?
Aye. Because they talk about a cold uterus. Like, I go between, like, obviously acupuncture, but see, like, Chinese medicine.
Yeah.
It's fantastic. So I kind of flick between the two, like, and I'll tell them to do things. Like, this is how I explain when you have clots and things like that.
Yeah.
For like people who have painful periods. And I say it's like making jelly. When you used to go in your grannies and make jelly, you hang with all the cubes, remember, and you put the hot water in, and you stirred it, right?
Such a great analogy.
And it flowed, right? Flows, right? And it's nice and it's warm and it's all, wish. No spilling it before you get it in the fridge. Then you put it in the fridge and you take it out and it comes out like solid clots. I mean, that's your uterus if you don't keep it warm. And folk are like, that's mental.
Did not know that. Top tip, guys. Listen to that. Keep your tootsies warm. Keep your tootsies warm.
Don't eat ice cream.
No ice cream?
So ending a fertility journey, don't eat anything cold.
Right, so this is so funny. I heard people talking about before, after you go for IVF, you should go and have a McFlurry and some McDonald's chips. I mean, what a load of shite is that? Who told people that? Is that the
But at McDonald's, I think. I work with folk that go abroad for like IVF, and they'll still find a McDonald's, whether it be in wherever it is, Turkey or Cyprus or.
Is this a myth? I imagine.
Aye. I always say to folk that probably the best time to take the McDonald's chips for the sodium, the salt, is post collection. So that you don't overstimulate, like so the salt in the water and things like that. But I think it's a myth. And but do you know what? I had somebody another night, but it's extended now, right? So folk only just go. Their families are going for it and sending them pictures.
Oh my God!
Yeah, McDonald's.
I can imagine them in the group chat. Right, I have to get image and fries.
I feel like this is another way for people to excuse eating shit.
Aye, we're going for a transfer the date. Right, no bother.
Bloody
everybody goes for McDonald's.
At least it's supportive, though.
Supportive.
How invested like people are and how much they want it, but the help and the support's not always there. Like they're that hopeful that they'll do anything to make it happen. That they've bought into this myth that McDonald's chips.
I know. And if they missed that out,
do you know that way?
And the transfer didn't work, they would think it was to do with the chips.
And see, to like circle back what we're chatting about, it's probably so far away from looking after your body and the basics of what has to happen. Like everyone's looking at what the big picture needs to be, whether it be going through like IVF or IUI, and it's like, see if they step back quite a bit and look at their basic health as an overall, how is their activity, what are they doing, are they keeping active, are they strength training, what is the food that they're putting into their body, what's their alcohol consumption, what else are they up to every weekend, like their sleep. And I think something we come across all the time in the club is one of the biggest reasons people come to curves is, I need to lose weight, I want to have a baby. And they've maybe been struggling to conceive, and they come in and you chat them through what needs to happen. They're looking to go on their IVF journey, they're trying to get their BMI to somewhere, and it's like that's what they want so much and they think that's the answer, but they just start looking after their body, they train a bit more, they move a bit well, and 3 months down the line you get a message and it's like, can I have a chat? And it's just like there's something in the water and that curves and you're like, wait a minute, actually, like it's just looking after you and taking the pressure off of going, right, I'll get myself into that physical condition.
Absolutely, because I get folk and they'll say, I'm waiting to go for IVF, and I say, how are you there? And if it's unexplained, I mean, sometimes as well, you know, both my tubes are blocked, you know, like you're right, okay, you need the medical model as well. And I say, right, it's my job now to get the environment ready and your head ready. But if it's just basically infertility and unknown, I'm like, I'm going to try and get pregnant before I need IVF.
Yeah. So that's that wee challenge.
And I think, you know, that leads really nicely onto what is it you actually do? What makes your practice so different from anything else that's kind of out there in this area in Ayrshire?
So initially, as I say, I just I done like aches and pains, and there was 2 girls I worked with, Maddie and Rihanna, like nursing wise as well, and when they were pregnant I'd done their acupuncture and things like that. And they'd been saying for a long time, why are you not doing this in the clinic? Come to the clinic 1 day a week. And I'm like, I don't think anybody would come. They were like, they will. Like, just stay 1 night a week.
Yeah.
So like 6 months later, they're like, so when are you starting? And I'm like, oh, do you know what, maybe September, maybe October. Anyway, so this night it was like, stood up there, took a picture, and Rhiannon was like, that's you, you're online.
You're coming.
And I remember driving home and getting my first booking. And like thinking,
straight away.
Oh my God.
Wow.
This is this is
happening.
real. Aye.
Yeah.
Mm-hmm.
That lasted, so they let me use the clinic. They didn't even charge me rent.
That's
Amazing.
kind.
They were literally like, just use the clinic. You can use it when we're not using it.
Yeah.
Build your business. Do you know, like, it's a great thing you're doing. Just go for it.
Yeah.
So I would give them, like, I was a Janny actually.
You cleaned, tidied, did all that.
I'll do everything. So if you need it, I'll do it. So years they were like literally just come in. So it meant like, see my trial patients, I didn't charge them. You didn't need to charge them because I didn't really. It was my time, and I chose to do that.
Yeah.
So they were really good. Brianna still laughs. She's like, oh my God, Debbie, I can remember you wouldn't cheer Jamie, but she said that's the nurse in you, like because you think you've got to do everything for free. You just want to help folk. She's like, you need to start charging people.
Yeah.
And I was like, right. £20, would you think? And she was like, oh.
Maybe a wee bit more than that.
Aye.
That's the cost of your needles, hen.
I know. James is like, are you actually making money? Probably at a loss. And then I think the eye opener for me was when we worked in the very first clinic. You always make a judgment about people no can afford, but anyway, she came in and she was in for pain. She wasn't nothing to do with fertility. Anyway, I was like, shall we so? I'll just charge her maybe 20 or 30. And she was talking about, is that a new skin, like the big new machines? And I said, aye. Anyway, I took 30 quid and she went off and booked a £500 course.
Never judge a book, mate. It's covered.
Like, Debbie,
she should have been 90 quid.
Aye.
I'm only joking.
And I was literally like,
no, people
you need
pay
to
for
that mindset.
And this is the thing I think that we're in, especially in the beginning. You think to yourself, you need to give so much away, but you've got to remember your level of skill, how much you invested in your training.
I pay for all my courses.
Exactly, and that's like, that's the thing. Like, see, if people need your service, they've got to be willing to pay for it.
But I think it's the fertility thing as well, and you do get slated if you work in fertility for like taking money. But then I was speaking to another girl who does stuff with fertility, and she was like, does them just like the doctors that are working this and taking 15 grand?
Exactly.
Like, seriously.
And then the private clinics.
What about the supplement companies online that are promising the world on a plate by taking this set of supplements at £90 a month? Like, nobody's slating them, giving them hope.
Yeah, I know. So I think that you have to get over that.
Yeah.
And I think a big part of what you do is we underestimate the power of actual connection and 100%. somebody listening to you that isn't your friend or your family, that's trying to make you feel better. See, you've got this expertise, this wealth of knowledge, but also this very loving and caring nature. You feel like you're like in your presence, it's like getting a hug for your energy, right? It is. So anybody that needs a hug from energy, this is your woman, right? But see that in itself, see being actively listened to and not judged, and being able to be 100% yourself and express your emotions, because you don't when it's your friends and family, because you don't want them to be upset with how you feel.
You're trying to protect everybody,
aren't you? And that's what we do as women. So see, for them coming in and even just being able to break that and just be like, bleh, this is how I feel.
It's great. I love when they do that. And they feel better when they go.
Yeah.
Huge.
And it is like, I think that when you work in female space, you can become very much like a therapist, which is fine. But I think like for you, you've got that starting point. People can come in and really speak to you, offload, and then you've got this almost like model that's going to help them. So tell me about
that. Just because what was happening was folk were coming in and they'll just get an acupuncture, but I was thinking they need something that, like they need a bit of Reiki and they need a bit of reflexology. They need to calm down and say, I can tell when I put the needles in folk how stressed they are. That's just years and years of putting needles in folk. So then I was like, you ever had your feet done? They're like, no. And I'm like, let's calm your feet, let's have an eye mask, let's do a bit of Reiki. And then it just kind of, like, folk will just book in and they'll say, I don't actually know what I'm here for.
That's an incredible thing, though.
We just go with how you're feeling that day.
Yeah, it's like treating them as a person and what they need. It's not like this is a box we've got to
folk,
check.
you'll
right,
always get acupuncture. But we'll decide what else we need to add in that day.
And at different points in their cycle and their journey that they're working through, they'll always need something different. But see, if you've been like that, right, where are we at? Right, this is what we need to do today. There's nowhere else they're going to get that, but also like the reassurance and belief that's given to them off the back of that is huge, because it's just somebody to listen. They've been into all these clinical things where it's like, oh my God, I'm petrified. They don't really have the information.
And I love it at the end of the reflexology, because I talk them through everything. I say, this is what we do, so that they know exactly what's happening. And then at the end, I'll do their feet and I'll say, I found that in your knee and this, and you're like, what? You're
witch doctor!
I'm like, so next time you're in, we'll put needles in your knee because that's got a bit of inflammation.
So I think the thing is, a lot of the time with modern medicine is that you treat a body part.
Yes, you don't.
Right? So if someone's got an earache, like they're not checking the whole body, the whole head, they're looking at one wee area. See, for you, because you're also an energy worker, right? You're treating the whole entire body as one connective like organism, do you know what I mean? And I think like that can be the biggest challenge, is see when you're looking at mainstream medicine, they're just treating a gut or a womb or a foot or a leg. They're not looking at the whole bigger picture. Everything dances with each other.
I know.
Absolutely every part. So you, from an energetic point of view, from an emotional point of view and a physical point of view, you've got it all going on, man.
Oh, huge.
I genuinely think, are you God?
But I think as well, like the actual professional expert that you bring, this is probably one of the biggest reasons like we really wanted to have you in the podcast as well. Like there's the holistic practices that you do for all these females and families, but there's also, you've got this such professional background from working in the fertility clinic to know what people are entitled to, what help and support is out there, along with trends that you've seen over years of actually having feet in the ground and experience it. And I think something we come up against a lot of the time is a lot of people don't know what they're entitled to.
Definitely.
They know their BMI, they know where it's got to be, but it's like, what actual help and support is out there for them?
Yeah.
And sometimes that can be blurry as well.
Yeah. Depending on who you speak to.
Aye, depends on who you speak to. And that's actually what, when I had my wee, and I had a wee day in the clinic last year. And it was a girl that had phoned, and she'd secondary infertility, so they had a daughter, or I can't remember, they had a child anyway, and she was attending the fertility unit, but fell pregnant before. Great, fantastic, that's what I love. So she didn't know she'd polycystic ovaries or no, because she'd never really got that far into her journey. Yeah. So when she was going for baby number 2, she was said to her husband, we might struggle, because I don't know if we were just lucky or whether I have got polycystic ovaries. So she'd phoned her GP and said, you know, what can you help me with? And they were like, nothing. You've got a child. And she was like, I know, but I want another child. And they were like, right, well, we can do bloods and we can support you, like with bloods and hormones, but I can't refer you to the fertility unit because they're not going to help you because you've already got a child. So she was like, then she felt bad for asking for another child, do you know what I mean? Like, she was like, oh, right, okay, that's fine. Anyway, I think 2 years passed and she was just randomly hoping for the best, and it didn't happen. So she thought, I'll phone this lassie, Nurse Debbie, see what she's got, if she can do with needles. And I said to her, are you sitting down? Because you were actually entitled, you are still entitled to, like, as long as your husband's semen analysis is fine, like 4 rounds at IUI. You'll not get IVF unless you pay for it privately, but you will. If you've got PCOS, you'll get Clomid for how long, it depends on your age and things like that, but you will get IUI. So she was like, oh my God. She said, I come off the phone buzzing to you, and then when she actually inquired, she was telling another story. Well, no, not necessarily. So then she phoned me back and she was like, oh, I don't think that's true. And I'm like, it is true. And then I phoned somebody else. And I said, can you clarify this information? She was like, aye, she would, you know, as long as everything's okay, aye. That lassie's now waiting for her IUI.
And surely to God, within and in a business like the NHS, there should be some sort of flow chart. This, make it easy to follow.
Even
see what you said.
GPs have a flow chart. What they're all entitled to. I actually checked the other day and I thought, I'm going to go in. It doesn't say anything about PCOS, but BMI of 35. Like, so nobody knows that. Well, they do know because we've told them, but and then tell your friends. But no, everybody knows that, and it changes from here. See, like Glasgow, like Monklands, and they don't have that. You've got to, but it's 30. That's it.
Okay.
Even with PCOS. Because I was telling them, oh, what's your BMI? And they're like 34. I'm like, oh, you've got PCOS, you'll be able to. Yeah. They're like, no, I'm not entitled to that. It's like so your arms that, but other ones on there.
It's mad that even in
so
the
it's not even across the board.
Like there's no consistency from like top to bottom with that.
So stupid.
And you just go like, how hard would it be for doctors to be given that and for it to be publicised?
And that trial was done like all over in Glasgow as well, so they should have the statistics to prove.
Imagine having that though online, so you can go on and you can find out where you've got to go if you've got A, B, C or D, right? See, for you to be able to go online, if you're like, you can click on the fertility part of it and it says, right, okay, follow this chart. You imagine how much more beneficial that would be for somebody to actually have that information. So NHS, if you're listening, finger it, flowchart time.
Flowchart, be great.
Flowchart time. Debbie will write you one if you want.
I could write one.
You could
It's not just
definitely.
like misinformation. Do you think, like, see at the kind of grassroots level though, do you think the misinformation starts when like birth control options are given out to like young girls and them not really understanding
No, it's if they
their
go with heavy
body and where it
periods,
then
it's just like, and I get it, because young folk don't want to be, you know, having heavy periods and clots. They take them, put them in the pill, they're happy because they're not getting that anymore, but you're just masking the symptoms.
And see, the thing, like, your period, having a normal period is a sign of good health. So if you're bringing like a young girl in and she's got clots, why are we not identifying what the fucking problem is? That there is an issue there. If she's bleeding irregularly, if there's challenges, find out what it is. Let's look at regulating that. What could we do? What could she be eating? What could she be doing with her body? How could she be moving? Not just, oh, do you know what we'll do? Band-aid. There you go. We'll band-aid it until she's 30 and then she goes and tries and has a kid and she's humped.
And identifying it doesn't make money, but does it?
No,
like, it is just giving them. I don't know how many people get into their late 20s or early 30s to start even think about having a family.
Parenthood's getting later now, but
are they able to? But they've maybe been on contraceptive from they were 16 up to their 30. That's like, what, 14 years of synthetic hormones pumped into their body, not really knowing what it's doing or what's going on. And as we say, like, your cycle as a female is your superpower. Like,
Definitely.
if you get in touch with that and you know what's happening in your body, but it's never really told that way when you're younger. Like, we talk about this all the time. When you were in school, it was like, right, you're going to bleed, that'll happen about every 4 weeks. You just go to your mum, there's a pad or a tampon, and aye, good luck. That was kind of it at the end of the day. As you say, you were told
you're
how
sexually
not to get
pregnant.
Aye, you were told how
2
not
days a
to
month.
get pregnant,
Like,
right?
if you're lucky, if you're
know.
super lucky.
And you just go, like, you're never told the bigger picture on that body. But again, if we all knew which what this is about, getting that information out there, then we'd all be in control of it a wee bit more, wouldn't we?
Definitely.
It's in the Change the World plan, girls.
I know, we've got to do it. We've got to do it.
Start somewhere.
Absolutely.
So when it comes to birth control, right, tell me what you feel is, how is it impacting the fertility of our nation?
But to me, birth control is like putting a car in a garage for 15 years and then coming back in the 16th year, putting the key in and seeing for the stairs. You know, like, and sometimes it will start for some people and that's great. And other times you've got to change a tyre, an oil, you've got all these different tweaks, and it's like putting your body into a menopause state and then going back and trying to turn it on and thinking, why is this not working? You're like, oh, this is bad, or I wouldn't take any contraception.
No
at all.
How do you think?
Even people that are saying to me, I come off that because I was crazy. Like, it actually sent me crazy.
If you think about it, your female body, unless there is something underlying, right, or there's an issue, it knows what to do. Right?
It's rooting for you.
It's trying to keep you alive. It's trying to keep you healthy, and it's whatever you're putting into it, surrounding yourself by energetically, physically, emotionally. Like, it affects everything.
I say that to folk because folk fall out with their body during fertility.
You talk about this actually. I love this.
Disengage for it, and I'm like, your body's literally rooting for you. So it's picking up the signals, and it's like high cortisol, stress, like all these different things. You're feeding it crap because you feel like crap. So it's literally, it shuts down your reproductive system to store energy to give back to you because it knows you're under, you're under attack. The saber-toothed tiger's coming to get you. But it's an email, it's, infertility or whatever. Because I get asked this all the time. They're like, why are folk that take drugs? They always get pregnant, and I can't get pregnant, and blah, 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 blah. And I'm like, right, let's strip it back. What signals is their brain getting?
Dopamine,
serotonin, whatever. Think about it. What signals is your brain getting? And they're like, right, I totally get it. So then they're like, do I take drugs? I'm like, no.
Not anyway. See, for you then, would you say, like, right, let's talk about stripping things right back. Stress, how much of an impact does that have on making a baby?
100%. I'm literally, see when folk come in, I'm thinking, stress. Look at your stress levels. you'll get you pregnant.
So what do you see? What do you recommend?
Folk come in and say, I'm no stressed. I'm no stressed, and I love my job and whatever. And
you know they're stressed even the way they're talking.
You're like, right, slow down.
High functioning stress.
They'll come up for there.
Because I've been like that forever. And then I think as women, and I was like that in the NHS. I would do the work of two folk. Do you know what I mean?
Like wear it like a badge of honour.
It was a total badge of honour. I can do the work of two folk. I see her, she's dead lazy. I can do the work of two folk. And folk were like, oh, I love being on me. You used to love being on with folk like that because they were so organised. We get everything done, but they were stressed out their head.
And didn't even know.
They didn't know. I mean, I'm like, I didn't know. I remember ending up in the hospital as a patient, and basically the skin was peeling off my hands and my feet and everything.
Burnout.
Total burnout. I was working. I just had loads on, and there was one night I'd sat, and it was like a Friday night, and I tried a pulse. My heart rate was about 160. I said, James, I need to go to hospital, and I would never have said that. And he's like, right, okay, you must be no well.
Yeah.
And I went out there and they thought it's sepsis.
Wow.
And then they took like my full body broke out, skin was peeling off, and they said it's stress.
Wow.
So now I know, see if I get a wee bit there.
Yeah.
I think, right, calm down, Debbie, that's it.
So, on you go.
And it's like your body's physical
My
response
body was
to tell
chapping.
you. It's like, come on.
It wasn't just a gentle knock, it was I'm coming
like,
through the front door.
I've been telling you, you're not listening, I'm going to stop you now.
And you can see for so many people that are going through that journey of trying to conceive, like they're up here on that high functioning stress, and the outside, like they might be like, oh, life's great, like get this successful job. Inside, everything is just, oh my god,
screaming,
closing over, trying to get help when they're expecting it, and that's to be able to create this amazing new life.
Because they're like, I've got a nice house, I've got this, I've got that. I'm like, this is the matter.
Yeah.
Do you know what I mean?
If you're not calm internally.
I know.
So how can you help people get calm? What do you do? What can I, like, tell me all about all of the treatments that you do and how they all work?
So I kind of work with people's cycle.
Yeah.
So first of all, folk, I like it when folk phone me or come to the clinic first, so we've got a wee chance to meet first. Folk that are coming with pain, you know, that's fine. But if we're going to go on a journey, then I say pop into the clinic, or we'll have a wee chat on the phone first, just to find out a bit about them, why they've got infertility, if they know, you know. So normally I have a good chat with them, and then I'll ask them about their cycle, and if they have painful periods, I would get them in before. So we're kind of trying to help with the pain as well. So you'll always get acupuncture, reflexology, and sometimes Reiki. That's my three kind of go-to wellness things.
Okay.
But I think you kind of beat acupuncture. Like if somebody said just day one the day, it would always be acupuncture. Or electroacupuncture and at the TDP.
Oh God, that's quite.
Yeah.
That's the one that I got. And remember, my leg was like, I was like, I'm not moving that leg, and it's like that.
I love
it's
it.
like pure robo leg. Honestly, I was like,
like that. I'm not moving.
It was the weirdest thing. I was kind of lying on my side, and the next thing, honestly, my knee just. I was like, I'm not doing that.
And I think folk forget we're made up of electricity.
Yes.
Yeah.
Because folk are like, what's with the electro? And I'm like, right, what's the first thing they're going to do when your heart stops? They get electricity through you. And they're like, right enough. I said, you've got electrolytes. Like if they're off, you know, in your blood tests and things like that. I said, we're made up of electricity. I think when you say energy to folk, they think that's woo-woo. See, if you got electricity, they would get it. And I'm like, we need electricity for neurons to fire off. We need electricity to keep your heart beating. So they're like, all right, aye. But if you called it energy, then they would be like,
It's a bit like, oh, airy-fairy still.
she's away again.
Now, see, for like...
I've felt that a few times in my life.
Aye, absolutely. See, for the benefit of like the listeners then, see with the acupuncture, what would your aim be for anyone that you're treating with acupuncture to be able to get for them?
To lower their cortisol, to rebalance their hormones, to get their cycle back on track, to make them feel better. Because I think like a lot of them, if they're waiting, if their BMI is too high, if they can do all the wee things, it makes them feel better. Like they're
in control of something.
Yeah.
Yeah, definitely. What's the wee one that you fire in your forehead? Remember you did that to me?
I
was like,
the third eye.
I was like, baby, I can't speak to you.
Folk actually shut their eyes. And even if somebody comes in with pain, I'll always put that one in. And then if they come back in, they'll say, remember that
What?
And
wee
put
one
after
there?
it.
Aye.
I was like,
Give me that again.
Put that wee one in there.
It was very nice. It was very nice.
It's calming.
Aye,
I say to
actually
folk,
is.
it's like you go in and you just turn down.
You just turn
cortisol.
down the noise a wee bit. So let's get on some myths, some myth busters, things that you have heard before that you would really like to bust out.
So I think the new TikTok, everybody's on TikTok.
Okay.
Is the cough bottle.
Oh,
Have
right,
you not
okay.
heard that one?
I'm not on
Aye.
TikTok.
I mean, I've
It's a
not
story
looked
for a
into it. It
different
might
day.
work. I don't know. But if you drink a bottle of, I don't know what cough medicine it is, but if you drink a bottle of cough medicine, you get pregnant.
Oh, right, okay. Right, everybody.
Aye, so
London and Marsden's
Carvonia.
Aye.
Carvonia.
aye.
We put a wee pregnant woman in the box.
Aye. A
So
bottle.
why? Do we know why?
Don't know. It might be just like somebody.
One person
One person
get right
just,
bang on
aye.
the cough medicine one
Aye.
night.
Somebody
Had
tried
a
the
good
cough
time.
medicine, then had a good time, fell pregnant. Now she's like, give us a cough medicine, nothing else.
Love a wee link down the bottom. I know. Probably.
Here's my 10% discount code.
Okay.
Sex positions. I'll get asked that quite a bit.
Right, so is
No.
there a sex position?
No.
No legs in there,
People-
upside down
I
on a
say to
hammock,
folk,
nothing like
if
that.
you want
no?
to put a pillow on your bum, your legs up in there, go for it. But if you think that works, that's fine. But there's no evidence to suggest that works. But so the myths and like some of them, I quite like a wee myth actually. Aye. Because if it helps you like mentally, then that's fine. But I wouldn't be spending money on myths.
No.
Okay.
Do you know, like I don't think a cough bottle's going to get you pregnant. I can't see that.
Can't imagine.
Doesn't really work in science, does it?
No, not really.
It's not really
Well, I
what
mean,
normally happens.
unless what's in the cough bottle. You never know. You never know what they're going to sell again.
I know.
Do you think the myths are more the myth, or is it more installing hope and that something?
Aye, I think
Something outside of yourself.
Yeah.
And I think that's the thing. It's
know.
looking for.
I think see as
outside.
long as it's not going to bring danger or anything, then just do it. Do you know what I mean?
Aye,
If it's going to make
whatever.
you feel better.
Yeah,
If it's going to just.
But like I wouldn't be.
install that
Some folk come in, they're spending £180 a month in vitamins, and I'm like, you're paying half of them out.
Yeah.
Do you know they're not going to? But it's like the lottery. See when they add things in,
one thing's going to work.
Yeah.
and then they're like, right, if I take that out, that might be the line that one. You know, that could be the
That
thing.
one thing.
So they just add to it and add to it.
Do you think people so much want to buy into the myth just so it's something else rather than actually looking internally at what they can do and what they can actually control?
And sometimes I feel even people coming in and offloading. It's like, she's got my problem now.
Yeah,
It's
She'll
a
sort it.
relief. It's a
Giving you
relief.
that baggage and that struggle.
The one thing I would say if we talk about male infertility
Aye.
is we used to see it when folk were drinking Monster. See these cans of Monster and things like that. I don't know if I told you
Yeah,
that.
you
or
did
not.
actually. Tell us about that.
So, like people who are going for IUI, they would get their partner would get their semen analysis tested just to make sure that it hit the criteria.
Yeah.
Then you might wait maybe like 4-6 months before your IUI. So they were like, right, I need to keep on top of my health. That's us. We're going to have a baby. They'd be going to the gym. They'd maybe be back shift. They'd be whacking. Think they were doing good going to the gym, but then having 2 or 3 cans of Monster. See when they come back with this. So anyway, you get the woman ready, follicles ready, right? We're good to go. Take your trigger shot. Partner comes in the morning, has the semen analysis, hands his wee sample in. The labs come up and they wash it and make sure there's nothing there.
Any movement?
No
or
movement.
No?
So then you would sit with the couple and they would say like, "What's changed?" Because it's been for normal. We're cancelling your treatment.
Oh my God, how devastating as well for
And
the women.
the only kind of real difference was energy drinks, protein shakes, not really watching what they were taking, but energy drinks.
So
was a
caffeine being like probably
aye.
the biggest.
Because it's such a high dose.
Aye.
And
So even would you say that that's probably even for men, if you're thinking about it, caffeine would be worse than alcohol? Yeah. Okay.
definitely.
And we've probably not even touched base yet on the impact that it actually has in relationships.
Because you were telling us about, like, usually the woman feels like it's all on her, but we were talking about even the man having to go in and the pressure to produce a sample and then the woman being like, you can't even do this right.
Okay,
like,
I know
so you
it causes
imagine
that.
And
I know.
even as well, something that's like absolutely meant to be there for pleasure all of a
Does
sudden
it
becomes a rota of...
I'm ovulating. Right,
Oh, that's
come on.
day, let's
You're back
go.
shift, I'm night shift.
And
Let's
if you
go on
think
it.
how that feels, like there's no like connection, there's no enjoyment there. Like,
And you're trying to say, if you get pregnant, that's how your baby was conceived. Do you know what I mean? That's sad. Isn't
And
it?
do you think as well, like, see if we think about this, right? My mum, right, and my aunties and all that, like, I'm 40 this year. All of the years ago, you weren't thinking about having a flow up. You weren't thinking about tracking when you were ovulation.
Okay.
We actually went in sync with, actually, how do I feel? Like, your body,
Yeah.
you're going to get horny when you're
When- I
ovulating.
know.
You feel wee things, wee movements and stuff like that. we've moved so far away from that we're tracking an app, we're pissing in a stick,
Yeah.
we're checking. Like, don't get me wrong, you said temperature's a brilliant one. Temperature's your temperature, like going with your body. But if we think about that, and even think about fertility now down the line with all of these additional extras out with yourself.
Because they've done a study in America in the full strippers. Did I tell you that one?
Yes.
And they made more money when they were ovulating.
Yeah.
Because they were sexier.
Aye. And you feel sexier. And what about the one night stands? You speak about this as well.
The one night stands as well. It's like, because folk will say, how do folk get pregnant in one night stand? And I could have sex every night. And I'm like, because they actually, up the dance floor, if they're ovulating, their progesterone's higher, so they'll be floating more, their muscles, less likely for injury, even in the gym. And I said they become more attractive to the opposite sex. Yeah. I said they actually give off a scent that I've never smelt, but seemingly.
Is it pheromone?
Aye. I said it's picked up by the male. So we're going back to animal instincts, right?
Because that's what we are.
That's what we are. I said, so then you're drawn to them, they become more attractive to you. I said, and then you add alcohol. And that's it.
Cooking with gas.
I think it's became such like a marketing thing now, fertility, like everything you spoke about, like your flow apps, your like ovulation sticks, all that kind
Loads
of stuff.
Loads of folk wear the aura rings now.
Yeah. Yes, this is a new.
I think they're actually all right.
Yeah. They've not been out for that long now though, but really it'll be interesting to see over a period of time what it actually does. But I think it just goes, people like are desperate when it's not working. Like, see, even that Aura ring, there's 400 quid, right? And it's like, right, this is going to help me, and it's always looking for that kind of next thing of what is that going to be.
I like them because it tells them they're stressed.
Yeah.
Like it tells them it tells them when they're unwell. Do you know, like things like
even
that?
like their sleep, and that's probably one of we talk about it all the time in the club, for even results, like sleep is probably the most underestimated thing that you could focus on. Everyone will be like, oh, supplement protein, creatine, this and that, and it's like, just see if you're not sleeping.
Your body's not repairing.
Nothing's working.
Definitely not. So what would you say for anyone that is on a journey and they're struggling to conceive naturally, what would you say is the first things that you would recommend they look at and start to think about?
So, they start to look at their diet and whether they're doing any strength training or any exercise whatsoever. Think about areas in their life that they are stressed. But like when folk come to me, they probably have been, like folk will say, well, I've been kind of half tracking for 3 months, but like the past 6 months I really have, but they don't know where's the first port of call. And I'm like, look at your lifestyle. Like,
what do you need for a healthy lifestyle for you, in your opinion? What do you need to be doing? Or what do you maybe, I always think it's not what you're putting in, it's what you take away. Like,
put boundaries in place.
Yeah.
Absolutely. You tend to find folk are like, they're looking after everybody else but themselves, and I said, just say no. And like, folk are actually all right when the folk aren't all right, well, they're your pals, or do you know what I mean? Like, do things that make you happy. I say, come here and get acupuncture, but if that's not your thing, go and find your thing. It might be going for a cup of tea with your pal, do you know, and just offloading, or a sound bath, or whatever. But I say to folk, find your thing and go with it.
Yeah. And I think
it's hard.
Aye, that makes you happy. Like, see, I think there's a lot in actually doing something for yourself that makes you happy, because you can get so drawn into the humdrum of just always being busy for being busy's sake, and maybe not filling your cup up. Like,
definitely.
So being calm.
I know. I love it when you file them up in the like when they've been in, and they'll go, I went to tell them this.
Good job.
Good job. Aye.
What can men do to support their women through this journey, and what can they do physically to get themselves in maybe a more peak condition to produce a great sample, or just good swimmers? You're having a good time, do you know what I mean?
Don't drink Monster.
Don't drink Monster. No Monster.
Red Bull, all that. Cut that out. Put that out. Obviously, alcohol as well. Vaping as well. I don't know.
You actually mentioned vaping because people thought it was just smoking. Why is vaping? Is it the chemicals?
We don't know enough about it yet, really, to be fair. And well, it's got loads of nicotine in it as well. Do you know what I mean?
But if you think about this, right, oil's got a burn point, right? See, when you cook, there's certain oils you shouldn't be cooking with and all of that because they become carcinogenic, right? So what we do with vapes is we take burning hot oil and soak it into our lungs, which is being absorbed into our bloodstream. Of course, it's fucking you up in all the ways. Do you know what I mean?
I know.
It's insane.
I had a guy years ago, it was nothing to do with fertility, but he'd been vaping and lung collapsed.
Aye. Was it they call that popcorn lung?
Popcorn lung, aye. And he said it was the easiest thing I'd done when I came out, put that in the bin. He said never again.
It's going to be interesting in years to come,
Oh,
like the more that
what's
comes
gonna
out
come
about
out.
that and the
Aye.
evidence, because honestly, like everyone's like, oh, I've stopped smoking. It's like, good on you, like well done, but you're literally sucking burning oil into your body now, like.
Also, I like.
It's so bad.
I genuinely like. I know people that never used to smoke who
And they
vape,
aye.
which is mind blowing to me. Like that'll wake up in the middle of the night and they'll be vaping, and it's so
The vape's
addictive.
just not out their hand.
Flipping France,
Like,
man.
it's there
Maybe we'll
regardless
have
what they're
another
doing.
conversation on that
Aye,
as
I
well.
know.
So stop the vaping, stop the
them.
energy cans.
Yep.
Energy cans, stop vaping. What else? I can't even think straight.
No, that's okay. See, for as well, I just wanted to kind of circle back to what we were talking about, rather than it always being tracking and stuff like that, because you've said in the past, like people think that they're meant to be ovulating and they're not. They're sick. Say they're ovulating. What would you say is a tip to know your female body is ovulating, other than what temperature should your body be, by the way?
So this is the thing. So if your temperature sits at like 35, 36 too, and then it rises to like 36, 8, then you just watch. It doesn't need to be like
Huge.
a huge rise, but if it starts to rise, then you're like, all right, I'm coming up for ovulation. It might then dip and then rise again.
Okay, and is that ovulation there?
Yes.
Right, at that point when it's starting to rise. So those are the couple of days.
And I always say, have sex before you ovulate.
Okay.
Have it ready and wait and let it just take delivery.
Love.
Aye.
I love that you make this so just normal and easy.
Yeah,
So
okay.
it's just like there's some there. 'Cause
Yeah.
it can live for like 4-5 days. Do you know what I mean?
okay.
So I have plenty. Even when we used to do when they used to do IUIs, we would say have top up sex.
Okay.
Like, so just continue to have sex.
Oh wow.
Aye.
Okay.
So try and have sex before you ovulate, but then folk are like, but I don't know when I ovulate.
Yeah.
And I'm like, well, we'll try and pinpoint that.
Yeah.
Just listen to your body, like your cervical mucus and things like that, like egg, sticky white egg and all that. Some folk don't get that. And then if they don't get that, they don't think they're ovulating.
Yeah.
I'm like, it's not necessarily, it doesn't
Just
go hand
getting in
in
touch
hand.
with our body a bit more and understanding what it feels like.
So it come back to cervical mucus for some people that wouldn't know what they're checking for. So it's like egg white.
Egg white, aye, sticky
so
egg
like,
white.
Yeah, so that would be when you're at your most fertile. When you're
helps the sperm get up.
Yep. When you have sex, is it better to be in the mood to have sex rather than it being, this is when I'm ovulating, let's go? Does that make a difference or not? Is it just the physical act?
I think it's it must make a difference. I mean, it'd be hard to try and scientifically prove that, but aye, your mind, your body, is it going to be relaxed? Is it just? I know folk that have actually fell out. Like,
you've said about this actually.
Aye, like they fought out and somebody he was going away to work and she was working, but she knew that was her window of opportunity because he was going to be away for 2 or 3 days. So she set an alarm for the morning and was like, we need sex.
And it's so robotic.
Aye, they had sex, never spoke, and then rolled back, went to sleep,
Oh my
went to work.
days.
Imagine knowing though that you're like wee
But she was like
I mean, you wouldn't give a shit if you were struggling. You'd be like, fuck it, go for it.
The thought of her missing a month
Was more
was
devastating.
more devastating.
And what about orgasm? Does that help things on its way
Well, they
because
say,
of the
aye,
contractions?
because of the contraction,
and-
aye.
Okay. So guys, if you're listening, make sure she finishes.
We always used to say, mind to your turn.
So those would be some of the top tips
Yes.
to know. For me, like you can feel wee things, almost like cramps, when you know that that's going to be like when you would be ovulating.
Some people can actually tell if they're ovulating for the left and right side.
Yeah. Yeah, so it's just
You tune
becoming
in. Tune in.
and no energetically in your body. Obviously, great idea to come and speak to a specialist like Nurse Debbie and do all of the things like come along to curves, do your strength training, eat well, enlist the help of professionals that are in professionals in female health and well-being. For men, supportive of their women, be a good shoulder to cry on, be supportive. Don't drink Hunter's a Monster.
No, don't drink Monster.
Yeah, avoid vaping. have a good time. Make sure she has a good time.
I know. And another one with guys is a varicose veins, like in their testicles. If you notice anything like that, go and get that seen to that.
Right,
can affect your fertility.
Okay,
and that's
good
happened
to
a
know.
few times in the clinic.
So what would happen with that? Would they get them
they can
away?
They can pay for it to get taken away.
Right.
You'd probably have to pay for it privately. They wouldn't put that down as. But it can affect your fertility.
Right, okay.
It was just a couple that I'd worked with that the GP said it wouldn't affect their fertility. So when they came and they were talking about things that they never mentioned it because they didn't think it would affect it. And it was the one factor that was affecting it.
Wow, God, it's so interesting. It's a minefield, isn't it? So
double check everything. If it doesn't feel right, ask for a second opinion.
A second opinion, I think, like that's the big thing for you. You send so many people back to ask information. Even one of our good friends, Lynette, she's just had really bad information through that completely. I coach her on Transform Lifestyle Coaching, and she messaged me right away to give me this information, and you knew energetically, and then she came and spoke to you. I think it was the next day, and you gave her hope again. You were like, no, go back, and she was given the wrong information, which you're just like...
Which would have ended her journey.
Yeah, like completely.
If she'd just taken that as what it was.
So, always ask for a second opinion. Or go see Debbie, who is... You're in clinic 20... No. And you're... I know. Hang on, you're...
I'm in Dr. Rebecca White's upstairs.
Yes.
Just Nurse Debbie Ayrshire.
Yes, so make sure you go on and get a good follow of the page. And we just want to say, listen, an absolute massive
thanks for having me on.
you.
And if anybody's if anybody wants to message me, I can just answer any of their questions and things like that.
Definitely.
Okay.
But please be sure to make sure that you share it far and wide, because it's a topic that is
and that's something I think we've not even went into the iceberg. It's
just like scrape the surface, to be fair. It's such a topic that a lot of people must feel that they're doing it on their own or don't feel comfortable to talk about it. So get yourself sharing it so people's got the information, but put yourself in communities where it's normalised as well, and you can chat, because when you open up, it's when it's a wee bit more realistic for you.
A wee bit lighter.
And you'll tend to find half the people sitting at your table will have their own stories.
Especially if it's 1 in 7 or 1 in 4 people that are struggling. So let's have these conversations. But listen, it's been an absolute blessing to have you on today. Thank you for joining us. Thank you guys for listening. Please come on, make sure that you're following the sisterhood. Please share this far and wide. Sharing Nurse Debbie Ayrshire's Instagram page, and let's just get this out here. But thank you so very much for coming today. Okay, thanks guys, see you later. Bye.